Good morning and welcome to Veterans Heartbeat, on the pulse of the veteran, where we discuss issues of health, happiness, opportunity, and well-being of interest to the veteran community, their families, and the community who honors them.
Hello and welcome to another episode of Veterans Heartbeat, brought to you by River, the Rural Institute for Veterans Education and Research. My name is Jason Zenkgraf. My co-host, Ed Lisowski, is here with me, and he is the Executive Director of River. We welcome you to a weekly, wide-ranging discussion of issues, events, opportunities, and needs in our veteran community. Good morning, Ed. How you doing?
Good morning, Jason. How are you doing?
Not too shabby. We also have Dr. Coffey of Yellow Pine Naturopathic Clinic here in the studio. How are things, Dr. Coffey?
Doing great, Jason. Nice to be here.
All right. We're happy to have you. We'd like to take this time to thank our sponsor. It's a great place for a guy to get a haircut. If you need a haircut, swing on by and check them out. The gals there do a great job. We are also sponsored by River, the Rural Institute for Veterans Education and Research, who offer many services to veterans, such as a weekly free pain clinic and educational programs that focus on veterans helping veterans. So today, we are going to focus on the Veterans Administration and cover a few topics that should help veterans navigate the VA system. But first, we'll be getting an update on things happening in the legislature from Mike Hopkins, House Representative, District 92. How are you today, Mike?
Hey, I'm doing good, sir. How about yourself?
Hey, not too shabby. Thanks for asking. So tell us, what's happening in the legislature that will impact veterans?
Oh, God, well, what isn't happening in the legislature? So obviously we got a whole bunch of different committees, and obviously revenue this time around isn't such a picnic for members. So one of the things, luckily, is that members from committees, from everywhere from education to appropriations and judiciary and the rest of it, have really tried to focus on issues that direct veterans primarily, and then Native Americans here in the state as well. So got a pretty decent docket of legislation moving through the legislature dealing with those two areas in multiple different committees.
Oh, fantastic. Is there anything that really sticks out to you that's exciting?
Well, I know. I guess it depends on what part of the issue you focus most of your time. Obviously, a lot of the work that I've been doing on that side of things is trying to connect caregivers with individuals within those constituencies that need care, right? So you got a number of different bills trying to accomplish that, many of them brought by Representative Wendy Voy and a bunch of his friends, everything from just directly kind of like the bills that we've talked about in the past, connecting caregivers with individuals who are looking for that care, but also starting up pilot programs, having educational programs, trainings, and right on down the line. So it's actually quite a good thing about this session. We got a lot of people that legitimately, honestly care a lot about this area of policy, and are doing their damnedest to come up with a lot of good ideas.
Oh, fantastic. Ed, do you have anything to add?
The only question I got, Mike, is any update on the CVEMT bill, the Community Veteran EMT bill that we've talked about?
Yeah, so just as a quick update, I mean, there's always two different lanes, right? There's the lane that the actual bill itself is taking, and then there's the lane that you, as either an author, sponsor, or somebody working on a bill, is taking. So on the actual bill itself, it's currently having language attached to it. Once it has its initial language attached to it, it'll go through a series of peer reviews, right, both on constituent side as well as on sponsor side, individual stakeholders of the bill. And then at that point, we'll look to get in touch with some committee chairs and figure out which committee that it will be making its way to. And then on the carrier side, or on the side of people who are working on the bill, we're just constantly reaching out to members, both just in the House in general, and then in the specific committees that we would think the bill would get attached to as soon as it actually gets language and it gets out of the gate. And then also already over talking to individuals on the Senate side. So, once we attach language to it, it goes to a committee on the House side. It gets voted on the House floor. It'll then go over to the Senate side and go through the committee and floor process once again. So already trying to reach out to them, make sure that they know what's coming down the pipeline, as well as get feelers for how they're thinking about the bill, or if they see any initial problems with it. And so far, everything's been looking really good. So we're pretty happy with where we are so far.
And that's the Veterans Suicide Prevention and Medical Extension Act, correct?
Yep, exactly.
One other quick question I got for you, Mike. Real quick, anything exciting happening for your district?
What I do primarily, other when we're talking about these bills, is I do appropriations work and then infrastructure work on long-range planning. And so a lot of the different sections, the Long-Range Planning Board administers about 12 different grant and loan programs, from everything from capital improvement projects, buildings like you would think, to sewer, water, reclamation projects, and the rest of it. So throughout House District 92, it takes in East Missoula, Bonner, Clinton, Potomac, Sealy, and Condon. So throughout those areas, there's a lot of different projects, from elementary schools to fixing up streams, and of course, if you live in Sealy, one of the things you talk about more often than not, certainly recently, has been sewer projects. And so there's a lot going on there.
All right, thanks, Mike. Have a good day.
Hey, you as well.
Missoula has a very active veterans community, and for this next segment, we are joined by Mike Garcia, the Public Affairs Officer for the VA Montana Healthcare System. How are you doing today, Mike?
I'm doing great. Thanks for having us.
Thanks for hopping on. So what are some of the things veterans should know about the VA system?
Well, I think the first thing that all veterans should know, and it's really the simplest, is you've got to constantly check on what your eligibility is for a variety of benefits. One of the areas we're always concerned about is with our older veterans. 30, 40 years ago, they leave the service. Maybe they applied for benefits. Maybe they didn't. If they did apply, they weren't eligible for any variety of reasons. Eligibility changes over time. We have one of the highest per capita veteran populations in the U.S. About 1 in 10 Montanans are veterans. And out of our veteran population, about three-quarters of them are eligible for VA health care benefits. In general, veterans who've served a minimum of 24 months on active duty and have an other than dishonorable discharge usually makes them eligible. But there's also a lot of exceptions to that, exceptions based on service-connected disability, exceptions based on when they served, their income for some of our lower-income veterans, and also special issues related to exposure. I'll use our Vietnam veterans as an example. 40 years ago, when they came home from Vietnam, they may have applied for benefits and weren't eligible for whatever reason. But now, as the years have gone by and the impact of Agent Orange, again as an example, now they are eligible for some benefits. And in some cases, family members might be eligible based on exposure. And again, that's just one example. But the bottom line is that veterans who believe that they have a service-connected illness, ailment, injury, even though they may have been disapproved for veterans benefits in the past, they really should contact our business office and have a discussion with them about that, because things can change.
Mike, this said, a lot of the Vietnam vets feel like, well, I don't have any evidence that's going to get me connected to the VA. They're going through the age right now where Agent Orange is a cause for prostate cancer, and I've had a lot of veterans that I've worked with, and your business office has been able to get them in for services. So what about the evidence that's required to connect them?
So in the cases where there's been a determination made that exposure to something like Agent Orange or ionized radiation or service members that were assigned to Camp Lejeune for about a 20 to 30-year period, the VA makes a determination when there's these large-scale exposures to various things as a presumed illness or injury. And so there's a whole class of veterans who simply have to meet the requirement of being on active duty and serving in a particular place at a particular time. And most veterans have some evidence of that, whether it be their DD-214, an old award, as an example, serving at a certain place. So again, it's important to contact the business office at Fort Harrison and have that discussion with them. Veterans may start that simply by saying, I think I have a service connection because I heard that I might, based on my service. Can you give me some more information? And our staff can help walk them through that and figure out what documentation they may need to support that. And in most cases, especially with the exposure ones, it's really all about, were they on active duty and were they assigned in the place designated as being exposed.
There's a lot of confusion, a lot of misinformation out there. So what is the phone number for these guys to call to get this information straight from the VA? Veterans
who might be interested in contacting our business office can call the main number at Fort Harrison, and that's 406-442-6410. And if they pick option 4, that'll take them directly to the staff that can talk to them about eligibility enrollment. And that's the first place they can start.
Well, that's great, Mike. So what are some of the other issues that veterans are having that the VA can take a look at?
Well, first, I think there's been a lot of concern recently about the quality of health care through the VA, not only in general across the nation, but also here in Montana. A lot of negative media coverage on a variety of different things, whether it be scandals in Phoenix or the recent sale reports that have talked about star ratings for different VA hospitals. And I want to assure veterans here in Montana that they are getting the highest quality health care available through their VA, and they should feel very confident to seek that health care at our VA facilities. And although this negative media has focused on specific areas, there's a whole lot of context that goes along with those. And so VA, both in Montana and across the nation, when there is an equivalent measure between VA hospital and a private sector hospital, VA hospitals come out at or above the standards that you find in the private sector. Our excess is improving regularly. That's something that we're constantly striving to improve. And quite frankly, although much has been made about wait times in the VA, what I will tell you is that in many cases, for routine care, the wait times at your local VA clinic is almost always shorter than at the local hospital. Now, that doesn't mean we want, if the veterans have a choice. I mean, obviously, if they prefer to seek health care at the local hospital, then by all means they can do that. But I want veterans to know that they should be confident that they're receiving the best care possible and available here in Montana through the VA. I'm a veteran myself. I served 4 years in combat. I get my care at the VA, and I have, when I see these stories come out, I don't believe that is representative of the care that I receive here in the VA Montana system.
That leads into an interesting point. Senator Tester's report on veterans in Montana said there were, 75,000 combat veterans in Montana, but yet, from what I've been told, 38,000 veterans are enrolled in health care in the VA system.
So I'm not familiar necessarily with Senator Tester's report, but the VA.gov and the U.S. Census says there's about 98,000 veterans in Montana, and as I said before, that's about 1 in 10. There's 1 of every 10 Montana residents is a veteran. Out of that, roughly 74,000, almost 75,000 are considered wartime vets. So that's either the Gulf War, which includes OEF, Operation Enduring Freedom, and Operation Iraqi Freedom, Vietnam War, Korean conflict, and World War II. Now, that 74,000, though, is a bit. That's the total, but if you look at the individual totals for each of those conflicts, the numbers don't add up because some veterans serve in multiple conflicts. So roughly 74,000 to 75,000 Montana veterans are considered combat veterans. When the VA talks about veterans, though, we talk primarily about eligible veterans and enrolled veterans. So there's about 73,000 eligible veterans in the state. And as I said earlier, that's about 3/4 of all veterans in the state. And only 47,000 are enrolled.
Okay, it's 47,000.
Yeah. So, and then there's one more number, and that I think this might be where you were talking about that 38,000. Those are the number of veterans that actively use their health care benefits in the VA system on an annual basis, and it fluctuates from year to year. But for the last couple of years, it's been right around 37,000 annually.
Okay. The point that I was trying to drive home is there are thousands of veterans out there that are getting misinformation somehow, and they need to call in and find out if they're eligible, because that's important to them, because this health care is good.
Yeah, I would say of the 26,000 eligible veterans in Montana that are currently not enrolled in the VA, I would suspect there's a high number of them that have assumed that they're not eligible or believe that the care that they need or would want they can't find in the VA, and I would say that both of those are false. They're eligible to call our business office and have that conversation, and the VA in Montana offers a full spectrum of health care services from physical, behavioral health, and mental, a variety of other benefits, also through our veterans benefits partners, a variety of vocational rehab services and employment services, GI Bill, home loans, et cetera, et cetera. So I agree with you. There's 26,000 eligible veterans in Montana who aren't enrolled, who likely should be those folks that I'm talking to directly to call our business office, have that conversation, and find out what their benefits are. Maybe that's the statement
we need to end up with there is, so there's 26,000 veterans that are eligible for health care that are not enrolled. So it's very important not to listen to the rumors out there. It's more important for them to call into the VA and check their eligibility.
Absolutely.
We still have Mike Garcia, the Public Affairs Officer for the VA Montana Healthcare System, on the line, and he's going to be talking about a few different areas of the VA. How you doing, Mike?
I'm doing great. Thanks for having me back.
Yeah, thanks for coming on our show. So I know there's a lot of confusion around the VA. A lot of people will get upset and frustrated because they don't really know how to navigate it. And you've done a great job in that last section explaining some of the areas that certain veterans may not fully understand. There's got to be some areas where there's a lot of confusion from your point of view that you see the veterans dealing with. What are some areas that you think you could help clear up for all the guys and gals out there?
Well, sure. Well, I'll tell you the big one that causes a lot of confusion, not only among our veterans and their families, but also, and quite frankly, on some days, our staff, is the CHOICE program. I think most folks in your audience have heard about CHOICE, and the intent of CHOICE was for veterans to receive the care they needed closer to home, and that is a good concept and a good intent. Where implementation was challenged in Montana, we're very rural and very large, is that this, and I won't go into too many details, but there was a third-party administrator that was contracted by the VA. For Montana, it's Health Net. And it was Health Net's responsibility to grow a network of providers, to go out, find providers who wanted to provide care to veterans, sign them up for CHOICE, and then send veterans their way. Well, a couple of things didn't go quite as planned. One, we don't have a lot of provider density in Montana. That's not just a veteran problem. That's a Montanan problem. We're a rural frontier state. We don't have a lot of doctors out here, especially the specialty doctors. And then we had to grow that. The Health Net had to grow that network to a sufficient level that would allow veterans to come to see a doctor closer to home. That didn't go as expected. So unfortunately, what we have is veterans who are either over 40 miles from their local VA clinic or cannot be seen at their VA clinic within 30 days become eligible for CHOICE. And then depending on what care they need, usually specialty care, Health Net finds the provider that provides that specialty care and sends the veteran to that doctor. Unfortunately, that doctor is not always in the same community. So it didn't deliver as it was intended because the provider density just wasn't there. One of the big points of confusion, a lot of veterans, and I was a veteran too who got the card in the mail before I worked at the VA, it looked to me like a health insurance card, and I immediately saw it as, okay, this tells me I can go to any doctor I want to, anywhere at any time, and as long as it's either service-connected or I'm willing to pay a copay, I can go see that doctor. That, unfortunately, was not what it was meant to do, but there are a lot of veterans who did believe that that's how it was supposed to work. And maybe that's how it should work, but that's not how the law was written, and that's definitely not how it was implemented. So CHOICE has definitely been something that has challenged both our veterans and our staff to manage their expectations. Hopefully, we have made a lot of recommendations through our members of Congress here in Montana, as well as leaders in VA on changes that can be made to make it better. Some of those changes have already been implemented. Others, I think, are on the way. One recently discussed in Congress was this idea that 40 miles, what does that mean? Is it 40 miles from the service that the veteran needs, or 40 miles from a building with a VA sign on it? Well, unfortunately, right now it's a building. That doesn't make any sense. So we've made that very clear to members of Congress and to folks who develop policy, and they're working very hard to try to adjust that. So I hope that will be a positive change in the very near future. A couple other areas, if I could, that always cause confusion, and quite frankly, it's really about veterans having a discussion with staff and confirming what their eligibility is. Dental. Very few of our veterans are eligible for dental services. Most of them are within 180 days of leaving service, and after that, there's no more. The only other veterans that are usually eligible are either homeless veterans or veterans who have a service-connected disability that specifically affects their teeth or some other oral part of their face or jaw. So that's always a bit of a contentious point sometimes, and unfortunately there are a lot of rumors out there that people hear that say, oh, no, you're eligible for dental, but you're not. Travel eligibility is another big one, especially in Montana, especially when you think about choice and how far some of our veterans have to drive. What I would say is the bottom line is with travel, and lodging kind of goes into this too. Not every veteran is eligible for travel. Not every veteran is eligible for lodging. There are a variety of different things that make them eligible. It is important for veterans to know whether or not they're eligible before they assume they are, and then apply for reimbursement or ask for VA staff to make lodging. It's usually either for service connection, if you're being treated for service-connected disability, or if you're over 50% disabled, a disabled rating from the VA, then you're usually eligible for travel and lodging. But even with that, it's exceptions, and that's why it's so important for veterans to contact the business office and to have that conversation with them, explain their situation, and ask up front if they're eligible for travel or lodging reimbursement or payment beforehand.
All right. Well, thank you very much, Mike, for hopping on. We really appreciate your time this morning, and we hope you have a good day. Thank you.
Hey, thanks so much.
Welcome back to Veterans Heartbeat. So far, we've gotten an update from Mike Hopkins about things happening in the legislature. We also talked with Mike Garcia, the Public Affairs Officer for the Montana VA healthcare system, who was very helpful in explaining eligibility and quality of VA healthcare, as well as common areas of confusion. I am joined by Ed Lazowski, the Executive Director of River, and Dr. Coffey of Yellow Pine Naturopathic Clinic. Ed, what do you think about everything we discussed today? Do you have any comments?
But I'd like to hear from Dr. Coffey what she's thinking of everything.
Yeah, thanks, Ed, and thanks, Jason. And special thanks to Mike Garcia for your time today. You know, several important points came up. One, that the veterans in Montana, please check your eligibility. There's a lot that can be gained from engaging in the VA healthcare system. And then Ed and his folks at River are really working on exploring how to diagnose veterans more accurately. We're looking into vestibular dysfunction. We're trying to create a model for a more comprehensive evaluation for veterans so that we can have more effective treatment. And we have several people who have already been through that process, and it's been working pretty well. So, of course, our goal is to share that with the VA healthcare providers. Certainly, there would be no benefit to us keeping that to ourselves. I'm a primary care provider. I'm here in Missoula. And certainly, any provider in the rural communities who could get connected with the VA and provide healthcare to our rural veterans would be immeasurably helpful. And one of the programs with River that's also addressing this need is the CVEMT, where we connect at least some healthcare services into those rural communities. And it's the idea of veterans helping veterans. And then my last thought, just this is on a little bit of a different topic. So I'm a naturopathic physician and licensed in Montana as a primary care provider. We're licensed in 17 states right now as primary care providers. We're not licensed federally, and so we're not recognized in the Veterans Affairs system. And that's something that we would really like to see change, because we happen to be really good at primary care, and particularly complex patients with a lot of different lifestyle factors going on.
Dr. Coffey, it's really fascinating to see these guys coming in with a lot of the opiate problems, and with the help of your allopathic or your MDs, we're able to bring them down off of a lot of the opiates without still causing a lot of chronic pain. So without using a lot of the opiates, how are you able to achieve, pain control?
Yeah, chronic pain is a known, extremely difficult condition to treat for any physician. And I believe in using as many tools as we can and trying to use the right tool at the right time. So the first thing that we have to do is look at each patient, each veteran, as their own individual person. And we talked a bit about this on one of our last shows, that not every veteran has the same experiences, the same exposures, the same injuries. So really looking at each person as an individual, getting a really clear picture of all the factors in their health. And then once we have diagnoses present, and usually it's more than one diagnosis, then we can start to get the right specialists, the right people, the right treatments involved for each of those. So acupuncture can be immensely helpful. Support groups can be helpful. Education can be helpful. Diet changes can be really helpful. If somebody has vestibular dysfunction, there's a whole set of protocols that can help with that. And each one of those then can lower the pain level a little bit. And by combining all of them, hopefully we get patients, veterans, to a place where they need less and less interventions and they can be more and more free about their lives.
Excellent. Well, thank you very much for listening to Veterans Heartbeat. We would not be able to bring this to you without all the support of the listeners. Thank you again to the Man Shop for sponsoring the show. If you're in need of a great haircut, swing on by and get a snip. Lastly, thank you to our main sponsor, River, the Royal Institute for Veterans Education and Research. They have an array of services such as veterans-focused education, free pain clinic, and many more services. Check them out on Facebook or on the web at riverofchange.org.
And let's also thank the veterans that are out there listening, and hopefully we're providing them the services. And if you have any questions, feel free to contact us. And if you have a suggestion for a show, let us know.
Join us next week where we'll be talking about recreational therapy and how it is benefiting veterans.